Gonzalez from our emergency management department. He is our director, so thank y'all for being here. I am heart-sickened by the news I have to share with you today. On Wednesday evening, a Louisville man in his 40s became the first Denton County resident to die as a result of severe complications from COVID-19. We at Denton County are offering our deepest, most heartfelt condolences to the family and friends of our resident. As your county judge, I cannot stress enough the gravity of the situation we face in Denton County, our region, and across the nation. The loss of our fellow resident underscores the importance of everyone heeding the mandatory stay-at-home order now in effect. The situation we face will get worse before it gets better. Let's be clear. How much worse depends solely on the actions we take today and going forward. Stay home, be responsible, wash your hands, and most of all, realize that your carelessness or cavalier attitude can and will unknowingly result in someone else's death. This is serious. It truly is a matter of life and death. Denton County is at a critical juncture in our fight against COVID-19. Our hospitals desperately need your cooperation to stay home and practice social distancing when you are out shopping for your essentials. To properly care for the sick among us, they need us to stop the rapid rate of infection. We cannot allow COVID-19 to spread exponentially in our communities and infect our most vulnerable residents. To put it quite frankly, a surge in cases will collapse our medical infrastructure. We simply cannot allow that to occur. We must flatten the curve to allow our medical personnel to do what they do best, which is save lives. However, we must all do our part to adhere to the stay-at-home mandate. Again, our deepest condolences go out to the Louisville man's family. My colleague, Denton County Commissioner Bobby Mitchell, who represents Louisville and is their former mayor, extends her heartfelt love and sympathy and her prayers to the Louisville family. I fervently hope and pray that we can come together as a united front to stop this scourge and help keep others from dying of COVID-19 in Denton County. We are in a fight for our lives and the lives of those we love and cherish. I believe we are at a crucial juncture here in our county. Together, we can help to flatten this curve, which is trending upward, or we can see a spike in the cases. May God bless you and be with each of you through this trying time. I would also like to provide an update on our caseload here in Denton County. At this time, we have a total of 83 cases. That is up 13 cases from yesterday. We have a total of 8 cases at the state-supported living center and 1 new case there today. So that is the total of 83 cases. I'll be happy to answer any questions you may have.
Judge, at this time, I know you've reached out to Governor Abbott about adding maybe temporary hospitals at the facility. Is that happening?
So Governor Abbott, first of all, thank you for the question. The question is, Governor Abbott, is he aware of our desire to have additional resources at the Learning Center, Living Center? And absolutely, he personally called me last night. He is aware of our request of additional resources. He called me last evening and expressed his deep commitment to this. He is in concert with the Denton County, the City of Denton, and Mayor Watson, his wishes and that of our Denton County Legislative Delegation that we increase resources here. Part of our big concern, and the mayor could address this as well, part of our concern was that there would be an flood or a surge from the facility here to our Denton County providers. And so we wanted to make sure that that was addressed so that we have capacity for the other people who need to use these same facilities. And so the governor's been great, our delegation's been great. We worked on it late into the night, and early this morning we've been working on identifying those resources.
Any idea the timeline of when those resources will be there?
The question is, when will the resources be there? We've already been out there. Part of the resources that we needed, quite frankly, was additional tests. And so the state was great a couple of days ago to expedite overnight additional testing kits here to Denton County. We got some other kits here in the area. We are continuing to have testing here in the county. Testing is limited throughout America. So Denton County is not exceptional in that fact. So there is a constraint in the availability of that. So we're having to prioritize. And so the state did help send those kits to us most recently. We are finalizing what that exact resources are going to be, to answer your question. As far as personnel and support, we are finalizing that today, and if not today, it'll be in the morning, so we'll be able to mobilize that extra talent here locally.
Does that testing include employees as well?
Okay, I'll let Dr. Richardson address that as well.
So we're expanding the testing efforts at the State Supported Living Center. Currently, we've been testing the most vulnerable patients in that patient population to protect the medical infrastructure because we are worried about surge. As testing becomes available, we're going to try a two-pronged approach. Again, testing and stratifying, prioritizing those most at-risk residents, and then adding the high-risk staff members. But that formula is a moving target based on risk and based on exposure. So we're really focusing on the highest risk residents right now, but that expansion of tests will include staff at some point. But again, I'm not sure when that point is because of both testing, my clinical resources here locally, making sure that we prioritize the most at risk first. And again, that is both to protect the residents, also to protect the medical infrastructure in the county.
So, Doctor, we saw at the state school that they started at around 1 o'clock to take temperatures of everyone entering. What other steps are being taken?
Denton County Public Health has made recommendations to the State Supported Living Center about guidelines for monitoring staff, high-risk staff, and the residents themselves. And to our knowledge, those guidelines have been followed. So we've acted as an advisor and a resource to recommend those guidelines to them. I can't speak directly to what they've enacted, although my understanding is that they have taken those guidelines and implemented them.
Can you explain what those guidelines are?
So again, the guidelines are temperature checks for residents, temperature checks for staff, some symptom screens, and then regarding the temperature checks, if someone does have a fever, they're sent home, or if they are a resident, they are isolated or cohorted with other residents who could be symptomatic. So those were the recommendations that we gave. And again, those recommendations are standard for the CDC and the state health department as well. So we're just echoing those best practices for the Living Center.
How many state school patients are in community hospital beds right now for any reasons aside from COVID?
I don't have the number. You would have to ask the State Supported Living Center on how many total hospitalizations currently. That number changes, of course, with admissions and then discharges. So I don't have that number in front of me, but the Living Center might have a current tally of hospitalizations for the residents.
How difficult is all these people living together to keep them isolated at the state school?
I think it's difficult. I think it just the challenges that anyone would imagine exist. I think the State Supported Living Center is faced with a difficult task, and that is to make sure that they're maintaining that physical and social distancing for those residents. But I think that's more challenging with that population than others, and I think they're doing their best.
Are additional cases expected later today?
We're still continuing the investigation, so we're confirming that case today. But what we do know in the community is there is going to be additional cases, and unfortunately, maybe additional deaths across Denton County because this is a pandemic. And so what we know is whenever we release the information for that day, unfortunately, we live in the reality that we know the next day is going to have more cases.
Do we know how many people were tested?
We did test 140 residents yesterday. And again, we're going to expand testing, and I don't have an expansion number for you because that's in flux because the investigation is ongoing.
Are additional health and human services personnel being brought in to help ease, just the flow if somebody is sick and they have to quarantine themselves?
You'll have to ask that of Health and Human Services and the State Supported Living Center. I can only speak to Denton County Public Health.
Has the county considered bringing in retired physicians or nurses to help?
So we have a medical reserve corps, and that reserve corps are people that have been previously trained, and we have been utilizing them for call centers and parts of the investigation. The clinical resources is a little more difficult, so we're working with the Texas Board of Nursing, the Texas medical examiners to understand the licensing requirements for someone who might be retired or have a license that was inactive. We're not to that point yet in the surge, at least from the county's perspective. I can't speak for the healthcare system. Hospitals will have to speak for themselves, but from the county's perspective, we have a limited number of staff, but so far we're meeting the challenge, but that could change tomorrow. So all options are certainly on the table.
I want to address that.
Oh, go ahead.
So the question was, are we looking to have volunteers or other people, maybe retired professionals, come and assist in our efforts? And I will tell you that yesterday on DentonCounty.com, some people go to DentonCounty.gov, it's the same landing page. We did install a volunteer button there, so I would just encourage folks that may be watching, if you want to help out in some capacity, not only the county and our efforts, but also perhaps our nonprofits as they work to address the issues that are going on across the county. I would encourage you to go to DentonCounty.com, go to our landing page there. There's a volunteer button there. Click on that. It's just a very few simple questions, such as your name, address, email information, and your cell phone. And what do you believe you could provide? What kind of talent and services do you think you could offer to Denton County in our time of need? So we would encourage everyone to go to that. I'd also like to talk today about something that is very important to me and so many other people across the county, and that is the mental health of our residents here. These are very trying times. We realize that these are trying times. There's financial strains on households, and I want to provide a phone number because our good friends and our partners over at Denton County MHMR, they're a wonderful group of talented and skilled care providers, and they have, thank you, Chief. I would like to hold this up. This is their crisis hotline. I would encourage anyone, if you are in distress and if you need someone to talk to, if you need someone to listen to you, to help direct you into some other additional resources, please call this phone number because they are there 24/7, 365. These are skilled and talented folks ready to help you. If you may not need help yourself, but if you see someone in crisis, please jot down this number or refer back to it at a future date and share this with them. I think Denton County residents helping each other during this time is what's really going to get each of us through this crisis, working together as a county. So I'd encourage everybody to avail themselves of that phone number and that wonderful resource from our friends and partners over at Denton County MHMR. Other questions? Yes, sir.
Just saw, Judge, that earlier today the independent school districts came out with an extension. Was there any thought about extending your current proclamation to April 19th also?
Thank you. The question is, the school districts delayed their openings. Is that what you're saying, that they delayed their openings till April 19th? Is there a consideration at the county that we would extend this order? I will tell you that we're going to be meeting on Friday of this week for the Commissioner's Court to ratify the executive order that I issued a couple days ago. So the Commissioner's Court at that time will take that under advisement whether we need to extend it or not. This is a very dynamic process, and I'll tell you, nobody wants to get the businesses reopened in Denton County more than me. It is important that I've spent a career promoting businesses here in the county, and that's exactly what we continue to do. So we understand and we feel the pain that our residents are experiencing, and so this is a very dynamic process. We're going to be in consultation with our health professionals and the statisticians that are monitoring this across the Metroplex and our fellow county judges as we look, because we really need to look regionally and holistically at this issue. So we had a conference call this morning with the DFW county judges, and we were talking about best practices and how we can implement these best practices, and also what can we look to help give us a sign of when we need to relieve these measures. So we're going to be monitoring that surge with our professionals. But so we will be having the Commissioners Court look at it this week for an extension, and I would say that we would look at this on a weekly basis. But if we believe that the tide has turned and we've been successful and we worked together and we got through this critical time and we flattened the curve, we allowed capacity for the health providers to have capacity in their system, and we did not have the severe spike. The minute that we feel that we're over that edge, we'll be able to relieve these measures. Yes, sir.
Also on that, are you going to be communicating with, say, Chamber of Commerce, various business groups, et cetera,
Yes.
and making sure they follow protocols? Or
Yes, sir. So the question is, are we going to be in communications with our chambers of commerce and making sure that they help us communicate this message out? Absolutely. We've invited our Chamber of Commerce CEOs, and there's over 19 chambers of commerce or business associations here in Denton County, and they've been welcome and invited to many of these phone calls when we're talking about outreach. And I would say that our desire, as we roll out these measures, our desire is to, first of all, educate the public. That is our very first step. We're not looking to come out and immediately look for enforcement. We want people to voluntarily comply, do the right thing, help preserve your life, the life of your friends and family by helping us stop this potential surge. So we're asking for people to voluntarily comply. Although this is a mandate, we're seeking people to voluntarily comply before there's any kind of enforcement measures. We really want to educate the public first before there's enforcement. Great question. Yes.
Have you been in touch with the governor at all, whether or not he should put statewide shelter?
The question is, have I been in touch with the governor about any kind of statewide measures? As I said earlier, the governor did personally call me last night. We did have a visit about the facility here in Denton County and also how we can support our healthcare infrastructure as a whole. We did not, in that conversation, we did not visit about a statewide mandate. I'm worried my focus, he's worried about statewide. My focus is right here in Denton County. Yes.
Is it too soon to tell whether people staying home is working?
The question is it too soon to tell if people staying home, if the people staying home is working? I don't think we can give you an answer to that right now. I would tell you I've been pleasantly surprised by the fact that so many people have been complying with our continued measures over this last week. I will tell you the restaurants, although they're hurting, they've also been in good spirit as well, many of them, as I've seen them adjust their business model, adjust for new ways to do business. And I've been very proud of so many of our residents here in Denton County that have said, we are going to get through this. We are Denton County strong, and we're out to support our businesses. People that are going ahead and paying in advance their barbers or their hairstylists to weeks in advance, knowing that they are shut down at this time, but knowing that they're going to go ahead and pay them in advance. So there's a lot of positive goodwill out there as people are coming together to get through this, and we realize that there's shared sacrifices for all of us. Next question. All right. Thank y'all so much.